Elderly are being dismissed and ignored by the government and Ministry of Health when it comes to the coronavirus response, according to the New Zealand Aged Care Association. And it's not confident District Heath Boards are ready for an outbreak in a rest home. NZACA represents all parts of the aged care sector, providing residential services for over 65s. Its chief executive, Simon Wallace, says despite requests to urgently meet with officials to develop a national response, they've been fobbed off until they went public with their concerns.
We've been trying to engage with the District Heath Boards and the Ministry of Health over the last week to seek reassurances from them and actually work with them on a nationally coordinated plan so that we're ready for coronavirus if we have an outbreak in a rest home.
So what's happening? Are they ignoring you?
They are ignoring us. This issue was raised by me at a national level meeting with between the aged residential care sector and DHBs on the 19th of February. I wrote to the DHBs on the 25th of February, and I only heard yesterday from the DHBs that individual approaches from individual DHBs was how they would be dealing with this. And that's been very piecemeal, that's been very patchy. My members are not getting the communication that I feel that they should be getting from their local DHBs, which is why we need a national level plan.
So what would a coordinated national response look like in your mind?
So that's about the sector, that's about the rest home sector working with the government on a plan, for example, where we can access practical things like the stockpile of equipment, that's masks, that's surgical gowns. It's assistance with our staffing. We're not necessarily resourced to deal with a big outbreak. So it's how do the public hospitals provide the support that we might need around staffing, for example.
So they have given you no assurances around additional staff should you need it, or any assurances around equipment, like protective equipment?
We haven't even had those discussions. So we haven't had those discussions, and we've seen today a case in America with a rest home where people have died and it has been linked to coronavirus. So we want to be able to work positively with these agencies so that we can minimise and manage the situation if it gets into a rest home here in New Zealand. That's all we're asking.
Are you saying we're not prepared should we get this in a rest home or a retirement village?
We are well prepared and well set up to deal with an influenza outbreak or a norovirus outbreak. But this is not business as usual with coronavirus. This is new ground, and we've seen the government close the border to some countries. And I'm raising the alarm bells today because we want to be prepared and ready.
Do you think that the government is prepared in respect to your industry?
I've not had the confidence that the District Heath Boards are prepared, and the reason I say that is because we are a membership organisation. We are in touch with our membership daily, and it's been a very piecemeal and patchy approach from individual DHBs. So there's been engagement in some regions, but in other regions there's been simply no engagement at all.
So what's wrong with dealing directly with the DHBs in everybody's individual regions? Because that's what you're suggesting they're telling you to do.
This is coronavirus. This is a global viral outbreak. It requires a national level response, and we're prepared and ready to talk to those government agencies. And it's a far more effective way of minimising and managing the situation rather than having to deal with a whole lot of 20 individual DHBs.
You do have a concentration of vulnerable people. I mean, what do they make of all of this? How are they?
Well, we've got family members who are calling in to rest home managers and nursing staff, and they're wanting to know what sort of plans are in place. So that's where the concern is stemming from, and that's part of the reason that we're responding. Lisa, only today have I heard from the Minister. I've been asking for a meeting with the Associate Minister of Health, Jenny Salisa, who's responsible for older people, and only today, after we've brought this matter into the public, have I had a response.
So what are you saying? The day that you give them a serve is the day that the Minister picks up the phone to you?
Absolutely, and that shouldn't be the way. We are, the aged residential care sector is a mainstream part of health. We provide a valuable service. We have 35,000 beds, and we are absolutely, we need to be regarded as equal partners with the District Health Boards, and that's not the way that we've been treated through this.
And that is Simon Wallace.